The initial interview, Evaluation Strategies for DSM-III Diagnosis, by Robert L Spitzer, M.D., and Janet B.W. Williams, DSW, ACSW. The second element in the series, this tape is subtitled Crisis Adjustment, MS. Dr. Spitzer is Professor of Psychiatry, Columbia University, and the Chief of the Biometrics Research Department, New York State Psychiatric Institute. He chaired the Task Force on Nomenclature and Statistics for development of DSM-III. Dr. Williams is Assistant Professor of Clinical Psychiatric Social Work, Columbia University, and Research Scientist in the Biometrics Research Department, New York State Psychiatric Institute. She coordinated the DSM-III field trials. Dr. Spitzer conducts this interview. Commentary is led by Dr. Williams. This program is published by BMA Audio Cassettes, a division of Guilford Publications Incorporated, New York, New York.
How old are you?
35.
35. And could you tell me how you came to Vanderbilt Clinic? What was the...
I was recommended by Albert Einstein, by the social worker over there. She called the doctor, and then they made an appointment, and I came in.
I see. Now, what clinic were you going to at Einstein?
Multiple sclerosis.
And how did they think that we could be helpful here?
Because I have a lot of anxiety, I guess. I get very upset because of what's happening to me. And so they thought maybe if I met with someone that can help me cope with this. And that's why I'm here.
I see. Did they knew that we had a group for...
No, they said that they had a doctor that would see me, and then they would have him call me and make an appointment. And I didn't know what kind of a doctor it was. I just thought it was a medical doctor. But
oh, you didn't realize it was in a psychiatric?
No. No, I thought it was a medical doctor. So I started coming.
Right. How long have you known that you've had multiple sclerosis?
A year ago.
A year ago.
Right. I think I've had it for about 3 years, though, because when I have a baby, 2.5, and while I was pregnant, I was getting these needles and pins in my hands. So that's when it started, I think. They kept saying it was poor circulation, but now that they diagnosed MS, I think that's what it was then too. So they've told me about a year ago, but I know from inside me that it was like 3 years.
Oh, and tell me about a year ago. How did they happen?
I went into the hospital. They did a lot of tests: spinal tap, brain scan, a CAT scan, a lot of blood work.
What symptoms were you having at that time?
I was having the numbness in the hands, as well as I couldn't hold my urine or the bowel movement. I couldn't. They didn't give me anything for it, though. It just sort of disappeared by itself. But, that sort of stuff. But my hands are still a problem. They're still numb.
And what's happened over the last year since they made the diagnosis?
I've had a couple of attacks, but they used another word for it, and it's been with my hands. First, my left hand was really bad, and then my right hand has been bad, and it's all it's still there.
How has that affected your?
Well, it's affected me a lot because I'm a key punch operator, and I can't use my hands to do the work I usually do. As well as in the house, trying to do the housework and take care of a 2.5-year-old. It's a lot.
Have you had to stop working?
No, I'm still working. One hand. One hand at a time. So, it's...
Now, you said that the reason that you have really come here is because of anxiety.
Yes.
Now, tell me how that...
Well, what happens is that you want to do things and you can't do them, and your mind just once you want to jump out of your skin because you want to do something and you can't do it. So maybe if I meet with other people that have what I have, and we discuss the different feelings, amongst everybody else, then I would really get to know, what's happening, because right at this point I don't know what's happening. I just know that my hands are numb and that I can't do what I used to be able to do, and I drop a lot of things, and that can be very frustrating.
Sure. How does the anxiety, how do you feel that?
Well, I just feel like I want to do something, and I just want to do it. I just want to do. I have to, it has to be done, and that's the only, I feel that inside. That's all. I feel like I want to, like, say, wash the dishes without dropping the dishes. I want to do it. I want to do it.
Well, but it seems to me that that's not the same as anxiety. I mean, that's
that's what I feel.
Well, what about just being scared about?
I get scared at night a lot because, when you're going to go to sleep, before you go to sleep, your hands go to sleep, your feet go to sleep, and that sort of thing. And so you get, like, numb, and you can only feel your body. You can't feel your hands and feet at times. And that scares you. That feels, that makes you feel like you're half a person. Half of you is here and half of you is where, You don't really know. So that, that does scare you a lot. And that makes you go through a lot of mental stress, because you don't know how to figure it out.
Yeah.
You don't know.
Has this gotten worse, this anxiety about your illness, or was it worse at another time?
Well, you see, I was put on a medication. I have taken two medications for this. One was Act Gel. They were injections. And I didn't feel too bad at that, but I gained a lot of weight. But when I took the prednisone, I felt very, very depressed. The day that I didn't take it, I was like lost. It was like, super depressed. Anything made me cry. And
how long did you take it?
No, 3 weeks on an on and off basis. One day yes, one day no.
Oh.
So
and the days that you didn't take it were...
I was very depressed.
And what about the days that you did get it?
Well, the days that I took it, I just felt like I could do what I had to do. The days that I didn't take it, I felt very depressed. Maybe it's supposed to be the other way around. But
how long ago was that?
In November, for about 3 weeks. November 14th.
So that was about 3 months ago.
Yeah, 3 months ago.
And did they stop giving that to you because of your...
They said that it made me to gain too much weight, and it wasn't really bringing my hand back to where I can control it. So the doctor said that I should stop and should just let nature take its course.
So that depressed
I
feeling,
don't feel that.
You don't feel
No.
that? Are there times, though, that you...
Not really. Not very often. It's like I have a lot of, things that I have to do. It's where, I work and I take care of my 2 daughters. And I have too much to do to be, thinking about what I have and what I don't have. But when I took those pills, it was terrible. I couldn't think about anything else but my hands and but really feeling really feeling like a mess.
Have you had times in your life before when you felt very scared or anxious that are similar to what you're going through now?
Only when I was pregnant for the second time, because I had to have cesarean, and the first time I thought I was dying. After I had my first daughter, I had a section, and I didn't know what to expect. I know all the pain and everything, so when I was going to have the second one, I really felt, like that's going to happen to me again, and I got a little scared, but it wasn't like that at all the second time. Didn't feel it,
But that scared feeling is somewhat like what you're...
Yes. But more scared is the thing with the hands and the numbness of the legs and the feet. It's a real something to think about when you're going to sleep and you can't feel that, because when you go to sleep as a whole, you just go to sleep. Your whole body, your brain goes to sleep or whatever. But when your feet first go to sleep and you don't feel them, they're not there anymore, and then your hands. I have even walked in the street, and I don't know how I walked, because I couldn't think. How did I walk a half a block? Because for that whole time of maybe, a half a block or so, my mind wasn't telling me how you're walking, and it's scary. That's scary. you feel like you have to hold on to the first thing that you see, the building or anything.
Have you ever gotten so scared that you just couldn't do what you had to do with your kids and going to work? Have you ever just been paralyzed?
No. No. Thank God. No, I haven't. I mean, it gets me scared, but I guess I can handle it because it really hasn't, I guess if I was ever in a wheelchair, sort of say, or if I was ever to get up in the morning and I wouldn't be able to move to go anywhere, then I guess that would really, upset me a lot.
Yeah.
But right now, since I am able to still walk, and I can't do the things I used to do, but I can do some things.
Yeah.
So that I'm not, like petrified that it's gonna, when I talk about anxiety, maybe we have a wrong, you have a thing, you think it's anxiety, and I have the concept that I think anxiety is like wanting to do something and you can't do it. Is that right?
Well, that's one way of using the word. I guess I was thinking more of the scared. And
I'm not really that scared. I just want to do things the way I used to be able to do it. Because everything else, you can live with what I have. You just have to learn how.
You're married now?
No.
No.
I'm divorced. I'm divorced.
So you're living with
my 2 daughters.
With your 2 daughters. Are there people that you can talk to about what you're going through?
I have a couple of neighbors, but I don't believe that I could sit there and discuss my personal life and feelings with them. I have friends, they're my friends and everything, and we talk about what goes on every day, but not about, I get very upset with my hands. And I wish for some reason that they can be cut off and put back in, to make them touch and feel. And I guess, I'm going through what other people are going through more. But to me, it means a lot because, I've never had to deal with this. Nobody that didn't have multiple sclerosis and didn't go through what I go through could say I understand because they wouldn't. I wouldn't be able to understand somebody in a wheelchair, because I've never been in a wheelchair. I can just say, I hope it never happens to me. But I can't really understand that they want to get up and they want to do, because it never happened to me. So, my hands.
What about, are you a religious person? Is that?
Well, I've been going to church. I've become a born-again Christian since I've gotten sick. And that's been a lot. That's been very good for me.
But tell me how that happened. When was that?
That happened, I was a Catholic all my life. And while I was in the hospital, I met a couple of ladies. One of them was a born-again Christian, and another young lady. And they would talk to me about, would I read the Bible, and, did I understand, how God does things for good. And
what was this when the diagnosis was made? About a year ago?
While I was in the hospital.
This was about a year ago?
Yeah, about a year ago. And, they did so many tests, and one of them stayed with me the whole time, just reading the Bible. After they did the spinal tap, you have to stay in bed, can't get up. So she's just reading the Bible and everything. So when I got out of the hospital, I decided that I would go to another church other than the Catholic church. And one of the girls from work happened to be a born-again Christian, so she brought me to her church. And I started going, and I've been there ever since. And it does help you cope with what you have, because you have like a relationship with the Lord, and you can, just as I talk to you, I can talk to Him, and I can feel that He is telling me, no matter what I do, it's going to be all right. And I believe that with all my heart. I mean, I'm going through this. It's like a trial, but it's going to be all right. So that's the way I became a Christian. It's good. When you have something to fall back on, to believe, to have the faith.
Is there anything else that perhaps we should be talking about in terms of your illness or how you're reacting to it?
Well, maybe about the way that the relationship with my children.
What about that?
I have a 13-year-old daughter, and, you know, she's a teenager, and she thinks now at the point that she's at that she knows, you know, just what's right and what's wrong. And sometimes, you know, like I can't do certain things, and I would ask her to do some kind of housework or something, and she would say, don't use your, you know, your illness as an excuse not to do something.
Mm.
That makes me feel kind of, you know, like I'm not, you know, I'm not doing my part.
Right, this is when you ask her?
Yeah, if I ask her to clean the tub, or if I ask her, you know, to
and
do
she
some
thinks you ought to be,
yeah,
should
she
do it
says,
as
you
a
know,
mother.
right. She says, Mom, you're always using your illness as an excuse not to do that.
Mm.
And maybe ordinarily I wouldn't feel, if I could do it, you know, I wouldn't feel bad. But now that I can't do it because everything just falls out of my hands,
Yeah.
you know, it makes me feel like I'm a little bit like not good enough.
Yeah.
Yeah.
And that must hurt.
It bothers me a lot.
Sure.
Yeah, it bothers me.
Are you able to talk to her about how you feel?
We talk about it, but somehow she just thinks that I'm trying to not to do the work, you know, to get out of it by doing it. And I never liked anyone, you know, to think that I'm trying to use them. I wouldn't use anybody. If I could do it, I would do it.
Mm.
That's the same way at work, you know. Not you know, I'm at a stage at my job that I'm the supervisor, so therefore, you know, I can tell them what to do, but I wouldn't be able to tell you what to do if I didn't know how to do it myself. So that if you couldn't solve it, I would you know, solve it for you and show you how it's done, and then you know, do it.
Right.
But you know, my daughter, you know, she just thinks that I'm trying to, you know, to get her to do more and more and more. And in a way, it's good for her because it's making her responsible for the future. Who knows, you know, what the future holds, right? I mean, I think in my mind that I am helping her by telling her do this and do that, you know, or let's see if we can, you know, mop or wax the floors. I don't think that's, you know, that's a lot of work because she has to learn how to do that anyway, you know.
Depressed. Right. But what about more recently? Are you bothered by crying,
No,
being
I'm not.
really feeling down? No?
No, thank God.
No? What about trouble sleeping? Do you have trouble?
Not anymore. Only when I'm gonna get sick, when my hands really act up, then I get the numbness of the feet and the legs first, and then I have trouble sleeping because I can't accept, you know, that I can't feel my legs and my hands. Now, you know, now it's okay. Now,
Do you ever have times where you're just thinking so much about your life and what's happening to you that you can't
well,
think?
when I experience, you know, like the not feelings of the hands and stuff, I think about it at night, and I can't, you know, I have a hard time falling asleep. But right now, once you have, you know, you've lived with the problem for a few weeks, it just becomes like part of you. So you know that the hands are going to be like that. But when you don't know is when you can't.
What about your appetite? How's that been?
Okay.
Haven't lost any weight?
No, I've gained.
Do you have trouble concentrating, say watching TV?
I don't like television. I
What
can listen
about
to the
reading?
radio. No, I can read.
No problems?
No problems. No problems.
What about symptoms of anxiety, like feeling your heart racing, or?
Only when I like, as I said, only when I'm in the beginning of I'm gonna get the sickness, then you know, my heart does pound very hard, and sometimes it bounces like, it feels like it beats an extra beat or something, because I can feel it up in my throat. But now, you know, once you have it for a few months or weeks or whatever,
You mean that's
you learn
when you
to
have
live
a new
with it.
symptom that you...
Yeah, when you're gonna go and it's gonna get worse. You know, I feel that your body does give you a sign, because something does happen to you. You know, whether it be the heart, or whether it be that you can't sleep, or whether it be that you feel your hand a little different, or your legs or whatever. But it does give you a little bit of a sign. You know, it doesn't throw you into it. And every day it gets a little bit worse, a little bit worse. But other than that, you know, right now, what I have, I can live with. You know, I don't like it, but I can live with it.
Okay.
Okay?
Thank you.
This interview seems to have 4 parts to it, as far as I can tell. The first part deals with kind of an overview of her chief complaint, And then once you and she have a rapport built up, you begin to ask her more in detail about the anxiety, which was actually her chief complaint. After that, you ask her if there's anything else you should be talking about, which is an interesting question. And then finally, you come back at the end of the interview and ask her more details about depression. So why don't we talk about each of these sections?
Okay. I knew from a referral note that she had been referred here from another hospital because they knew that we had a program for patients with MS. I think one of the interesting things was that she kept using the word anxiety, that was the reason that she came here. Yet when I actually went into what she meant by that, it turned out that it was really very different from the kind of anxiety that we think about in terms of psychopathology. In fact, she often said that for her, what anxiety meant was that she wanted to do something and she was unable to do it.
This ends side 3.
You kept using the word scared.
Well, I wanted her to know that when I was using the term anxiety, it was different from the way she was using it, and it seemed to me that the closest non-technical approximation to what we mean by pathological anxiety is scared. I suppose I could have used the word fear.
Well, how would you describe what she had? I mean, would it be worry that, or just wishing that she could do what she couldn't do? I mean, certainly she was also scared about the future.
She certainly had anxiety about the future, and that anxiety, of course, is a very realistic concern. I accepted the diagnosis of MS. I had no reason to question the diagnosis that she presented with. I suppose if you didn't have the referral note and she had, described these various symptoms, you might have to go into that. So knowing that...
Well, I'm not sure what you mean by that.
Well, in other words, if she had just started off by saying, I've had these periods of difficulty...
numbness and tingling.
Right. Then I suppose one might, consider the possibility of a conversion reaction, but there was just no reason for me to believe that. So I assumed that she had MS, which is a life-threatening illness, and so when she is talking about anxiety about the future, I accepted that as a bona fide concern. I think in some ways she almost didn't want to deal directly with that fear that she had, and she was talking more about how it felt for her to not be able to, for example, use her hands, and how frightening that was for her.
Mm-hmm. And I guess that is different from the kind of anxiety that we generally associate with
Phobias,
psychopathology
sure, it's a very
anxiety disorders.
It seems to me it was very focused. It was very realistic, and she described in a very poignant way what it must feel like to want to use your hands and just be unable to do so. Also, she was particularly frightened by these experiences at night, I guess, while she was, I think she often talked about how this felt when she was lying awake, I guess, trying to fall asleep, and she would have these periods of numbness and loss of control of her body, and this is very frightening.
Right. Now, after that section, you go into asking her more details, I guess still trying to make sure that her anxiety was not a part of some kind of anxiety disorder. What do you think about her associated
I guess
symptoms?
my feeling was that although she was presenting this in a very realistic way, she was concerned about knowing about the illness. She was hoping that she could be part of a program where she could be with other people who had this illness and she could learn how to better cope with this. I guess I was, in the back of my mind, thinking how much denial is there here? How much is she really scared? And therefore I kept returning to the issue of anxiety, but I think each time that I did that, pathological anxiety just really did not emerge as the predominant symptom.
So she didn't reveal having any associated symptoms that would have changed your mind?
No, I don't think so.
Mm-hmm. After you went through all those associated symptoms of anxiety, then you ask her a very interesting question. And that was, is there anything else we should be talking about?
Well, again, I was concerned that maybe there was more that was bothering this woman, that perhaps her concern with the MS and dealing with it was only her ticket to coming into the clinic, and maybe there were many other areas. Now, what that did reveal was a very realistic or a real problem that she had with her adolescent daughter. And it's something that she needs help with, and it's something that is bothering her. It's a kind of, again, her daughter is telling her, gee, Mom, I think you're using your illness. Well, at least from our perspective, there doesn't seem to be any evidence of that. And it seems as if the daughter has a problem accepting the fact that her mother has this life-threatening illness. I guess the daughter would prefer to think, hey, my mother is a little hypochondriacal or something, than accepting the fact that her mother has a life-threatening illness.
Mm-hmm. Certainly that would be something that one would have to take into account in planning for treatment.
Right. I would think that would be a very big part of treatment, how this, helping the mother and the daughter work through this kind of a problem.
And helping the daughter accept her mother's disability.
Right.
Mm-hmm. After that section, you came back to ask her more about depression. I believe you asked her if more recently she'd been having symptoms of depression, such as crying or feeling down. Why did you come back to that?
Well, again, my sense in listening to her was that this was predominantly a very realistic problem that she was having. I didn't see any serious evidence of psychopathology, but again, I was concerned that perhaps there was another area that she didn't want to really talk about, and given the situation that she's in, it would seem to me depression was a very real possibility. So I wanted to thoroughly explore that, and I did. Again, I think what emerged was not very much evidence at all for serious depression.
Although earlier in the interview you had asked her about that before, and she mentioned that she had been feeling depressed when she was taking prednisone,
right. I think
that's a steroid.
Right. Now, that's an important point. When I say I don't think there was any evidence of depression, I'm talking about her current, situation.
Mm-hmm.
But she gave a very good description of a period of depression, which
about 3 months ago, I think.
Right, about 3 months ago, and I think it lasted for several weeks. She's taking steroids. I was a little confused there because she said that she was actually depressed when she stopped taking it.
Right, she was taking them on one day and off one day, and the day she didn't take it, she felt depressed.
Right, I don't quite understand that.
Well, but aren't steroids known to cause symptoms of mania?
Well, it may
maybe
be...
she was feeling very good on the day she took it.
Right, it may be that the steroids actually did give her a period of elevated mood, and then following that, she kind of crashed. But I think if you take that entire period together, you can make a very good case that she had a steroid-induced affective syndrome, but that was not part of the clinical picture.
Right, and it seemed to go away when she stopped the
Apparently,
steroid.
the reason that she stopped taking the steroids was that she was having these side effects, and more importantly, it didn't seem to be helping the MS, which was what they had hoped for.
Right. And then I believe right after you finished discussing that with her, you did ask her if she'd had other times in her life when she was depressed.
Right.
And she said no.
No.
So, and even when you did come back to it, you then actually went into the associated symptoms of depression, asking her about her appetite and concentration, and she said no to all of those.
Right. Actually, that reminds me, I also asked her, if you recall, about past periods of anxiety, if she ever had any, and that made her associate to the period where, what did she have, a cesarean? Or?
Yes, she had a cesarean.
She had a cesarean, and also that was very scary for her. But again, I think it was more the fear of not knowing, what was going to happen. And that episode also seemed to be within, kind of normal limits of anxiety given that situation.
Right. So how do you put this clinical picture all together diagnostically?
Well, the first question I guess you have to ask yourself is, here's a woman with a very real life-threatening illness. Although she comes in saying that she wants help in dealing with anxiety, and that raises the question of an anxiety disorder. It raises the question if a specific anxiety disorder is not present, and there just didn't seem to be any evidence for that.
Which specific anxiety disorders would you want to rule out? Which do you think would be likely?
Okay, if she had had a prolonged reaction of anxiety, which was really maladaptive, and by maladaptive I mean so intense that it interfered with her functioning, which she claimed it really did not. She was still able to continue working. There was no evidence that this, whatever we want to call it, anxiety, fear, or whatever, was disorganizing her functioning. But if, let's say, that had been present, if that had been going on for a long period of time, then I suppose a generalized anxiety disorder would be one possibility, or probably an adjustment disorder with anxious mood would be the other possibility.
Let's talk about that for a minute, because I believe DSM-III does not require any kind of functional impairment for a diagnosis of generalized anxiety disorder, and it also only requires a minimum duration of a month, so it wouldn't actually have to be that chronic in order to give that diagnosis.
Right.
In a way, that diagnosis is weaker than adjustment disorder, which does require that the clinician make a judgment that the reaction is maladaptive.
Right. Well, presumably you would give the diagnosis of generalized anxiety disorder if the full clinical picture of the associated symptoms of anxiety were present. For example, if she talked about being so anxious that a good deal of the time she had palpitations, she was sweating, she had difficulty concentrating, she had trembling, shakiness, symptoms
And it really were persistent.
And if it really were persistent, then I think the diagnosis of generalized anxiety disorder might make sense, even if there had been a psychosocial stressor or precipitant, as there clearly is in this case.
What if there were no real interference with her functioning?
Well, I think you're probably right. Technically, the diagnostic criteria don't require that. And if the full clinical picture of generalized anxiety disorder were present, you would give that diagnosis. But it clearly is not present. But let's say that she didn't have all of these symptoms, but she had one or two symptoms, and it was very disorganizing. Let's say she was so anxious that she said she had difficulty functioning in some way. Let's say she felt she just couldn't go to work because she was so worried about what was going to happen to her MS. Well, let's say she said she felt she was having trouble with her daughter because she was so anxious she couldn't concentrate and she was neglecting her daughter, something like that. If you put those features together, I think you can make a case for an adjustment disorder with anxious mood.
Then you would have to have made a determination that her reaction is maladaptive.
Right. I mean,
do you think it was?
Well, okay, that's really the bottom line in this kind of a case, where a person is reacting to a very real, life-threatening situation. I think you have to ask that question: is this reaction within normal limits? Now, what does that mean within normal limits? First, I think you have to ask yourself, how would other people react given that kind of a situation? And I think you would probably agree that her reaction was, if anything, might even be better than what many other people's reaction might be. It seemed to me this woman showed a lot of strength in the way she was dealing with this. So that would be one thing you would ask. What is her reaction in relationship to kind of norms of what you would expect? But the other, which is probably even more important, is it disorganizing in her, her life in some way? Because
well, that is a function of whether or not her reaction is maladaptive, too.
Right. Well, I think that really, the definition of maladaptive really comes down to that. To what extent is this disorganizing?
Is she able to cope with it and keep her life going?
Right. I mean, now, if you think of, for example, what's a normal person's reaction to being run over by a car, well, it might be that anybody, given a particular, car accident, might have a broken leg. Well, a broken leg is still pathological, whether or not, most people, given that situation, would have it. The reason it's pathological is because a broken leg clearly interferes with functioning. So I think the issue here, more than the normative issue of how would other people react, really comes down to, and that's also a very difficult issue. You don't know how other people react. But I think we can say...
it's such a serious illness, it's hard to imagine almost any reaction that's really maladaptive to it.
No, no.
I suppose if someone took to
no,
bed...
No, I think somebody could become suicidal. Somebody could become so disorganized, for example, that they didn't seek proper medical care. I think that would be an example. Somebody could deny the illness, for example. You know, and that I think would be clearly maladaptive. Somebody could have, you know, let's say she had rage reactions against her daughter. So no, I think one could think of situations in which one has a clearly maladaptive reaction. I don't think in her case it is. Right,
I agree. So that rules out generalized anxiety disorder and adjustment disorder with depressed mood.
Right.
Where does that leave us?
Well, it leaves us with that section of DSM-III, which is precisely for problems of living which might require clinical attention and might even be a focus of treatment, but are not mental disorders. And those are the V codes. And there's a whole list of them. And I guess those V codes are not really a serious classification because there are so many different kinds of problems that are not mental disorders that may come for clinical attention. And I guess in her case, the closest V code would be life circumstance problem. We don't have a separate V code, perhaps there ought to be, for reactions to medical illness, but I guess that would be where it would be.
And using the DSM-III multi-axial system, of course, you would list her MS on axis 3.
Right. So on axis 1, you would say V code, life circumstance problem. Axis 2, we didn't go into personality functioning, although I have a sense from the interview that it would be very unlikely that you're going to find serious personality problems. So I guess you would you could either say no personality disorder if you felt pretty confident of it, or you could say axis 2.
Diagnosis deferred.
Right, diagnosis deferred. Axis 3 would certainly be the MS. Axis 4.
Well, the stressor in this case is clearly having a serious illness,
right,
which would be rated as 5 severe.
Right. In other words, the axis 3 is the physical illness of MS itself as a condition that you certainly have to know about in planning treatment for this woman. Axis 4 is really the psychological aspect of reacting to having this life-threatening illness.
And axis 5, which is for highest level of adaptive functioning in the past year, I guess we have to consider the difficulty she's having with her daughter, although then again it doesn't really sound as if that's her fault as much as her daughter's maladaptive reaction.
Right. It would seem to me from everything we know she would get a very high rating on axis 5.
Right, probably at least a 2. Very good, which indicates that she has better than average functioning in social relations and occupational functioning.
Right.
I know you recently spoke to this patient on the phone.
Right. I called her because I wanted to make sure that it would be okay for her to, I needed permission for her to let us use this interview.
So also, this is about a year after the interview?
No, it's actually, I think it's 2 years.
2 years.
Right. Also, I did want to know how she was doing, and it is interesting. She was initially referred here because we had a group
for patients with MS.
For patients with MS. She apparently was in that group for 6 months, she explained to me, and didn't find it very useful. And apparently many of the patients there, I guess, were sicker than she was. Also,
physically sick.
They were physically sicker. Also, they apparently were of a, I guess they had more economic problems, and which she did. But in any case, she didn't find it very useful. But the most important thing that happened to her is that she remarried, which is interesting. She married someone who worked with her at this place where she was a key punch supervisor. They have moved. In fact, it was I had to do some detective work to find out where she lived. She's moved to Upper Westchester, and I spoke to her on the phone, and she indicated that she had, I think, 1 or 2 bad exacerbations with the MS, and in one of them she was actually had to be in a wheelchair. but she's that is over. She is getting along, she said, better with her 2 kids.
Is she still able to work?
No, she had to stop working, but she sounded rather cheerful. Clearly, the most important thing that's happened to her is the remarriage, and I guess feeling that she's got somebody there that she can rely upon. So that was, kind of good news to hear.
Good.
This ends the second tape.